Human beings are social animals accustomed to interactions, human company, and freedom. However, COVID-19 challenged this very basic nature of people by confining them in their homes and restricting their movements. In the previous part of the series, COVID-19, an unforeseen worldwide challenge to mental health, we talked about the psychological impact of COVID on labor force, resulting in the grave phenomena of Great Resignation. And in today's part, we'll talk about the massification of individual retaliations against COVID norms, which started off as retaliations against masks by not wearing them or wearing them just for the sake. Ultimately, our expert will address the questions asked by the protesters and see its solutions. As governments introduced stricter measures to curb the COVID-19 wave spurred by the highly transmissible Omicron variant during the Christmas week, protests intensified across the EU in 2021. Measures included mandatory vaccination for certain professions, lockdowns, and mandatory face masks for school children. The protesters were particularly irate in Germany and its neighboring countries. Tens of thousands of people marched in the Belgian capital, Brussels, to protest against anti-COVID measures. Protesters carried signs slamming Belgian Prime Minister and the COVID safe pass required for entry into numerous venues. In the Netherlands, a second night of riots broke out on 19 December in several towns and cities. Austria's capital Vienna also witnessed protests in huge numbers after the government announced a new national lockdown. Protests of similar intensity had been observed almost every week since the government said COVID vaccines would become mandatory from 4th Feb 2022. In Croatia, thousands marched in the capital Zagreb to show their anger at mandatory vaccinations for public sector workers, while in Italy, a few thousand protesters gathered at the ancient Circus Maximus chariot racing ground in Rome to oppose Green Pass certificates and many more. Owners of restaurants, bars, pubs, and pizzerias said they will open the doors of their premises despite restrictions as a matter of survival. Museums and concert halls temporarily turned themselves into beauty salons and gyms in Netherlands in protest against the Dutch government's coronavirus restrictions. Amsterdam's Museum Square treated 50 people to an orchestral rehearsal accompanied by a hairdresser's scissor snipping on stage. In England, seeing all the protests and commotion, the government of England decided to take action against it and finally came to the conclusion to treat it as a common flu, dropping all the necessary guidelines regarding it, such as work from home guidance, compulsory face masks and COVID passes, and many others. But the isolation of self after testing positive is still valid. The COVID-19 pandemic has hit the US economy hard. Financial insecurity and continuing uncertainty about the duration of the restrictions are effective motivators to fuel the anti-COVID lockdown movement. This resulted in protesting against it. The protesters have already successfully mounted enough pressure in Florida to have some beaches resume limited public access, and Texas is aggressively moving forward on plans to relax restrictions on business operations. At the same time, numerous health experts are asking citizens to be patient and urging for restrictions to extend to mid-May and beyond. In Concord, New Hampshire, many gathered to send a message that extended quarantines were not necessary in a state with relatively few confirmed cases of COVID-19. State's Revolutionary War era slogan, "Live free or die," was seen being used. Among the demonstrators were several armed men wearing face-covering hoods. Started in early November 2021, protests continued in Los Angeles even in the month of February 2022 against masks for citizens and school children with slogans of "Free our kids." Protesters tossed hundreds of masks on the roads to show their dissupport and anger against the country's indoor mask mandate. In India, according to Section 3 of the Epidemic Diseases Act, anyone violating the rules of COVID, especially compulsory mask rule, will be committing a punishable offence. However, regardless of this, there are a few who think that this rule has no efficacy because masks are of no use in fight against COVID-19. They are India's anti-maskers and anti-vaccine protesters. Evident from the graphs, almost 10% of the people are wearing N95 masks, but 30% are going without masks. Talking about the state and city-wide statistics, Varanasi is lowest in the context of masks. In Meghalaya, anti-vaccination protesters organized a rally in the capital city Shillong against the alleged mandatory inoculation drive by the state government organized by the NGO Awaken India Movement (AIM). Most people argued that they were disguised by the mask and not happy wearing it. They are feeling suffocated. About its disposal method, which also created a huge problem, it could be seen that it is flushed in toilets or thrown away, which is affecting the environment. As a result, Maharashtra government is compiling research for the state if there can be a relief to citizens on wearing masks by planning to make masks non-compulsory in Maharashtra. Finally, moving on to a Q&A section with experts, where our today's esteemed and honorable expert is Mrs. Manisha Deshmukh, a homeopath with 26 years of experience. The cases in India are decreasing significantly. However, it can be seen from the past experience that carelessness and let-go attitude of the people led to a surge of cases again. So what precautions do you suggest to be taken by the people now to completely control the spread of COVID, especially when they are not willing to obey the norms?
Absolutely agreed with you. I personally believe carelessness is the cause of spread of COVID. SMS, social distancing, masking and sanitizer would be the most effective way. Though people are tired of following SMS, still it would be the safest measure for protection and stopping the spread. Vaccination would also be important. If the first 2 doses are not completed, they must be taken at earliest. Booster dose should be taken as scheduled. Unnecessary travels must be avoided. If necessary, then proper precautionary measures to be taken care of. We also need to work on improving our immunity. This would be important as there is possibility of mutant variant. Like every living creature, human beings have innate immune mechanism. Exercise, diet, sleep and mindset are the 4 pillars of immunity. Exercising daily for minimum 45 to 60 minutes, which includes a circuit of aerobics, weight training, balancing and flexibility techniques, and pranayam for 15 minutes. It can be of anything as per your choice and availability. Yogasanas consist of all the mentioned poses which bring aerobic benefits, weight training benefits, balancing and flexibility to the body. Yoga is not merely bending the body, it is for mending the minds. In diet, water is the most important part of diet. Minimum 50 ml per kg body weight water is needed per day to keep our system working efficiently. At least 2 fruits daily as per availability. Salads, freshly prepared meals, especially home cooked meals, would help to keep us energetic and healthy. Dry fruits like almonds, cashews, dry dates, regular dates, pista, walnut, daily in small quantities would help provide proteins required to form antibodies and daily repair of cells in our body. Sprouts and a vati of curd would help to get B12 which is very important to build immune system in our body. Diet plays an important role in providing nutrition to our body, which in turn helps in formation of hormones, enzymes, gastric juices, pancreatic juices, cell wall, mitochondria, Golgi apparatus, nucleus, and daily cell repairs. Our nutrition is going to keep our DNAs right and help in prevention of lifestyle disorders. Sleeping 7 to 9 hours daily at night would be very important to build immunity. Everyone has a body clock, and the clock also sets our hormones right. From sunrise to sunset, sympathetic system is active and cortisol is higher in blood. Sunset to sunrise, parasympathetic system is active and melatonin, growth hormone and sex hormones are on higher side. Cortisol keeps us upright, ready to fight and flight reaction we all go through the daytime. Melatonin, growth hormone, sex hormone help in cell repair, peacefulness, calmness and much more. A balance between these two systems is very much needed to build our immune system. Many disorders like diabetes, hypertension, metabolic disorders, autoimmune disorders, PCOD, ADHD, attention deficit hyperactive disorder are due to imbalance in these hormones. Mindset is the most important pillar of immunity and health. As advances in technology, we have stopped using our legs and are using our hands and mouth more. We are using hands on phone, laptops, gadgets and eating. We are using mouth for eating and talking. Getting angry easily, very less patience, greed, unnecessary competitions, envy, jealousy, suspicion, getting hyper, not wanting to share things with each other are biggest reasons of secretions of huge amount of cortisol and unnecessary adrenaline. As said earlier, imbalance in hormones is due to emotional turmoils and needs more amount of nutrition. Hence, nutritional deficiency is the major cause of many diseases. 95% diseases are psychosomatic in origin and can be prevented with precautions and some minor corrections in lifestyle and mindset. As we go out for work or college, we spend our confidence and energy in society. It is necessary to regain confidence and energy from food, love and care at home. Surprisingly, this is not happening nowadays. This is about outer world. In our inner world, we need to return to our home, means observe our body, mind, thoughts, become calmer inside and disconnect our sense organs, intellect and ego from our mind, which helps us face the next day with confidence and energetically. We all need to work on it consciously and help each other become healthy and have good immunity, so that in near future, even if any variant of COVID appears, we can fight it back and keep going, facing the stress and tensions in healthy manner.
One can observe that the states which earlier reported the highest number of cases are now insisting on being mask free. So, can we say that with the declining number of cases, we have achieved herd immunity against COVID-19 or are close to achieving so?
Yes, of course. Herd immunity has been achieved due to vaccination and disease per se. Some states have allowed mask-free behavior, though not official all over India. Still, I would recommend using mask in high-risk areas like public places, public vehicles, hospitals, pharmacy, offices where many new people are moving around daily like banks, post office and many more. Using mask has also protected us from regular flu virus in the last 2 years.
Educational institutions are now reopening, but since majority of school-going children remain unvaccinated, they are asked to wear compulsory masks. What could be the long run side effects of wearing masks for a long time on children as well as not wearing masks at all, since government has made masks below the age of 5 non-compulsory?
Below 5 kids do not have competency to use mask. Hence, it is non-compulsory. Children in schools, while playing and having food, would have to remove their mask. They also tend to keep them in unhygienic places, which in turn would cause some other infections. Whenever in classroom, if they have to sit within 3 feet from each other, they must use mask. If more distance is available, then we may choose to take mask away. Government has given green signals for vaccination in children, and soon most of the kids would be vaccinated and antibodies would be formed to fight against COVID. Regarding long-term side effects of using mask on children, I feel there should be none, because the preparation of mask is in such a way that no long-term side effects on health are there. But in fact, if they have to use it for long period of time, then it may happen that they don't drink water, they don't eat food properly, or they don't eat any snack, and thirdly they play less, they don't run around, so that activity might be hampered. But as such, no long term side effects would be there. In fact, I would say using mask for long time in a public place, in crowded places, in schools would in fact prevent some viral infections, also some bacterial infections like tuberculosis, etc. So no long-term side effects of using mask in children would be observed.
COVID is still not over. Cases are still being reported. But people in old age or those suffering from comorbidities such as asthma feel suffocated in masks, yet form the most risky group. What precautions would you suggest for them to protect them from COVID?
People in old age must avoid traveling to public places. If unavoidable, then SMS, sanitization, social distancing and masking should be followed. Vaccination would play a huge role in protection. Also, elderly people must work on reducing the comorbidities. People feel suffocated in masks, but when I look back at doctors and paramedical staff, we have to use masks for 6 to 8 hours continuously. Compared to that, for others, it is for lesser time. If at all, elder people have to travel to public places, then they must follow the social distancing protocols and take care of themselves. I hope soon this COVID period would get over.
Finally, to conclude, we can say that there will be definitely a risk of infection even after achieving 100% vaccination, as one is not sure of when will individual body develop 100% immunity against the virus. But measures to protect even if we go mask free will be the same, with the use of hand sanitizer for hand hygiene and taking care of one's own immunity by having a proper high protein diet and regular physical exercise.